Welcome to our short video on questions we've received on the monthly care management services for chronic care management or CCM. My name is Ellen Barra. I'm with the Provider Outreach and Education team for WPS Government Health Administrators. We provide more resources in the description of this video. This includes a CMS MLN booklet on chronic care management. We also have more YouTube videos on CCM. You can access the playlist CCM to view these videos. We also have an extensive question and answer document available in our Learning Center. Care management services are for all the care you provide during the month. These are generally non-face-to-face services you provide to the patient based on the care plan. This is time spent establishing, implementing, revising, or monitoring the care plan. Here are some of the questions that we've received. Can clinical staff provide the monthly care management service? The answer is yes. We would expect clinical staff to provide most of the care management service. The staff must be clinical rather than ancillary staff. The AAPC website provides a good definition of what is clinical staff. The web address for this definition is in the description of this video. How do we submit charges when both the clinical staff and the practitioner provide the monthly service? You can only submit the practitioner code or the clinical procedure code in a single month. You can add your practitioner time to your clinical staff time, but you can't add your clinical staff time to your practitioner time. There is an exception when the hospital outpatient department or HOPD provides the care management. The HOPD can submit the clinical staff procedure codes, and the practitioner can submit the practitioner codes. Can we count face-to-face time when the patient comes in and meets with the clinical staff? Yes, when that care is part of CCM, you can count that time. Do not include that time with any other service. Can we count time spent on patients' problems that are not the two chronic conditions? Yes. The care plan developed for the patient includes all the problems the patient has. Your care management will address all the problems listed in that care plan as needed for that patient. Can we use hospital nurses for after-hour care? When clinical staff provide the service, it must meet the Incident 2 guidelines under general supervision. The hospital's nurses must have access to the care plan. They would also have to have an employment relationship with that billing practitioner. Can we use an answering service for after-hour care? And the answer for this question depends on how you're using the answering service. Your non-clinical answering service staff must have information on those patients that are part of your CCM program. The patient must have 24/7 access to clinical staff to provide care or education. These are just a few of the common questions we've received. If you found this information helpful, like and share the video. Please leave us a comment. We want to hear from you. If you do not already, please subscribe to our YouTube channel. This allows you to receive notifications when we post new material. We have a QR code up on your screen. We have a survey web address in the description of this video. We encourage you to take the survey. We want to provide the education that you need and want. Thank you for your time.